Inlays and onlays are the future of restorative dentistry and have replaced crowns as the ideal way to restore more extensively damaged back teeth. Their main advantage over crowns is that they don't involve any damage to healthy tooth structure. What are inlays and onlays? Inlays and onlays are the ideal way to restore extensively damaged teeth when fillings won't work. Where a large part of a tooth has been lost due to decay or damage or fractures or tooth wear, fillings won't tend to last very long because the material that we use for fillings is not as strong or as resilient as natural tooth structure. Chewing forces will cause the fillings to fracture or wear out within a few years normally. The traditional answer to this problem was crowns, where the tooth is cut down to a stump and covered with a shell, usually made from porcelain or metal or a combination of both. The problem with this approach though is that these teeth have generally been hollowed out by decay or previous damage, so a lot of the interior of the tooth is already missing and only an enamel shell generally is left and not much more. A crown destroys most of what's left of the shell, and so very little of the natural tooth is left after the crown prep. So why don't all dentists just do inlays and onlays instead of crowns? The simple answer is that this type of dentistry requires a lot more time and skill than traditional techniques like crowns. If it's not done properly, the restoration will just fall out or break. A poor quality crown will tend to last longer than a poor quality inlay or onlay. It tends to take less time and often costs more. What is the cost of inlays and onlays? At the Modern Dentist, inlays and onlays range from £750 to £1,050. The cost depends on what type of material we're using, how extensive the restoration is, and how much time both the prep and fit appointment are going to take. Benefits of inlays and onlays over crowns. Even the most conservative crowns are destructive to natural tooth structure. Inlays and onlays don't cause any damage to healthy tooth structure when done properly. Crowns can often cause reactions from nerves in live teeth, so you can get sensitivity and pain, or in some cases even nerve death. This is very unusual with inlays and onlays because, again, they're non-destructive. So in a tooth that's got a healthy nerve, we don't tend to go anywhere near the nerve or do anything aggressive to the tooth which would cause any reaction from the nerve. Over time, if gums recede around crowns, they tend to develop these really ugly visible margins, which often then leads people to replacing them. With inlays and onlays, again, when they're done well, the margins just blend beautifully and disappear, making them essentially invisible. So even if the tooth changes or the gum changes over time, they don't become any more visible than when they're placed. What are inlays and onlays made from? Most of the time these days, because we want to bond the inlays and onlays to the tooth rather than cementing them, which is what used to happen in the past, we tend to use either porcelain or a hybrid of porcelain and composite. These bond incredibly well to the tooth structure, meaning that they will last for years or decades without ever coming out. Gold and other metals can be used for inlays and onlays, but this is less common these days because they don't bond to the tooth in the same way that porcelain and composite do. What's the process for inlays and onlays? The treatment involves 2 visits. The first visit is the prep visit, and the second visit, often a week or 2 later, is for the fit. So at the prep visit, the first thing that we will do is numb you up, assuming it's a live tooth. We'll then use rubber dam, which is a barrier that we use to separate the tooth from the rest of your mouth. The advantage of the rubber dam, there are many advantages of the rubber dam, but the main one is good isolation, which we need when we're doing any kind of bonding work. But also if we're removing something like an amalgam filling, it prevents you from swallowing or inhaling any of the mercury. Following this then, we prepare the tooth, and we prepare it exactly the same way as if we were just going to fill the tooth. So we remove any old filling material, any part of the tooth that is damaged or cracked or not savable, but everything else we keep. Once the tooth is prepared and cleaned, we then carry out a really important step called immediate dentine sealing. This is where we bond a very thin layer of adhesive to the exposed denting or the sensitive live part of the tooth. This has many advantages, including preventing sensitivity or pain between the two visits, but also, very importantly, gives us a much better bond strength between the restoration and the tooth at the fit appointment. We then take a 3D scan of the tooth, which gets sent to the lab, and we place a temporary restoration to fill the space until the fit appointment. The second visit is the fit of the restoration. Usually for this, because of the immediate denting sealing, we don't actually need to give you any anesthetic. We do use the rubber dam again for good isolation so that we can keep the tooth dry and clean when we're carrying out the bonding procedure. We will try in the restoration, make sure it fits perfectly and looks good, and then we treat both the tooth and the restoration to make them ready for bonding. This involves air abrasion or sandblasting, acid conditioners, and adhesive agents. And then we use a heated up white filling material as the cement that bonds the two together. And then finally, we carry out any adjustments to the bite. We do any fine polishing and make sure it all feels comfortable and that you're happy with how it looks. Aftercare for inlays and onlays. The aftercare for inlays and onlays is really easy. They effectively behave just like natural teeth. So you look after them the same way that you look after your own teeth. This means good oral hygiene, brushing preferably with a good electric toothbrush, and flossing or using interdental brushes, and maintaining a diet that is low in sugars and acids. You should also see your dentist and hygienist regularly for checkups and cleaning to make sure that everything is healthy. FAQs. Are inlays and onlays safe? Inlays and onlays are really safe. The materials that we use are proven to be biocompatible and allergies are extremely rare. How do I look after my inlay or onlay? Inlays and onlays are incredibly easy to look after. You just treat them like natural teeth. So you should maintain a healthy diet that's low in sugars and acids, use a good electric toothbrush, use floss or interdental brushes between your teeth, and see your dentist and hygienist regularly for checkups and cleaning. Which is better, an inlay or an onlay? Inlays and onlays are exactly the same type of restoration, and they're just different terms that dentists use to describe where they're located and how extensive they are. So an inlay tends to be within the walls of the tooth, whereas an onlay covers part of the tooth. What are the disadvantages of inlays and onlays? Honestly, the only disadvantage of inlays and onlays compared to crowns is the temporary restorations. We don't want the temporaries to bond to the tooth structure because we never get them off. So we use a material that's essentially wedged in between the teeth and that can be just popped out afterwards. But because of this, sometimes the temporaries do fall out between the prep and the fit appointments. This doesn't really cause any major problems. It's usually not an aesthetic problem. It doesn't cause any sensitivity or pain. And the only issue that you will tend to get is that you sometimes need to floss out some food from between your teeth. What's the lifespan of an inlay or an onlay? The lifespan comes down to a couple of factors. Number one is how well it was done in the first place. And number two, how well it's being looked after. If it was done very well, and it's being well looked after, and this means a good diet, good hygiene, then we can expect they will last for many years and possibly decades. Can you get a crown after an inlay or an onlay? In theory, yes, you can crown any tooth that has had an inlay or an onlay, but these days there are basically no scenarios where I would choose to crown a tooth instead of replacing an inlay or an onlay. Is an onlay cheaper than a crown? Quite often, inlays and onlays are cheaper than crowns, sometimes significantly so if it's a straightforward, simple restoration.